Here's how to properly inject your Ozempic pen. I'm gonna cover everything: the needle attachment, the injection sites, the exact technique, and safe disposal. Plus, I'll show you 4 mistakes that our patients make that waste medication and reduce effectiveness. Let's get started. If you're new to my channel, hi, I'm Dr. Jones DC, and I lead the coaching department of our nationwide medical practice where we've trained thousands of patients on proper injection technique. First things first, let's gather the materials. Okay, so you have your Ozempic pen, you have a new pen needle. We use 32 gauge 4mm needles, 2 alcohol prep pads, a sharps container, cotton balls if you have them handy, and make sure you've washed your hands. Quick note on the needles, by the way, there's a reason we're recommending 32 gauge 4mm. Clinical studies actually show that these ultra thin needles reduce pain by 30% compared to the thicker options. While the 4mm length perfectly reaches your subcutaneous fat, that's the fat tissue right beneath the skin without the risk of going too deep. They work for almost everybody, regardless of body size. All right, you got everything? Okay, good. Before anything else, let's do a safety check. Look at your medication through this window right here. It should be clear and colorless, just like water. If it looks cloudy, has any particles, or it's frozen, don't use it. Ozempic should always be crystal clear. Now, here's the mistake that's literally throwing money away, and you've worked too hard for that. What most people do is they prime before every single shot. Let me show you why that's wrong. First, attach your needle, paper tab off, twist clockwise until it's secure, remove the outer cap. I want you to save that. Inner cap, you can trash it. You see this right here? That's pure money. Here's what nobody else will tell you. You only prime once when you first open a new pin. That's it. Think about it. Each pin has exactly 8 doses, but if you prime all 8 times, you're wasting up to 20% of your medication. At $900 per pin, that's $180 monthly in the trash. Finito gonzo. First use only, turn to the flow check symbol, that's 2 units, point up and press until you see a drop. Done. Every injection afterwards, skip this step completely. But here's where it gets worse. This next mistake means you're not even getting the dose that you think you actually are. First, dial your dose. Turn until your prescribed dose appears in this window right here. Make sure you can see it clearly. Now, watch this common mistake. That medication on your skin, that should be in your body. Here's why this happens. Ozempic is thick, way thicker than insulin or B12 shots. It needs time to fully deploy. Press the button. The dose counter hits 0. Now the critical part, 1 Mississippi, 2 Mississippi, 3 Mississippi, 4 Mississippi, 5 Mississippi, and 6. Now remove. Be sure to keep the button pressed the entire time. You might hear a click, that's normal. You missed this, you're getting partial doses. I've had patients plateau for months thinking that they needed higher doses, but it turns out they were only getting 70% of their medication because they misunderstood this crucial step. Before we inject, clean your site with alcohol and let it air dry. Where you inject matters more than actually what you might think. Keep hitting the same spot and you'll create scar tissue underneath. Medically, it's called lipohypertrophy. Basically, it's just lumps that develop over time, and they can literally block your absorption by up to 25%. You're going to create medication-resistant zones, and you don't want to do that. Here's our clinical rotation system. Your belly. Stay 2 inches from your belly button, divided into 4 zones. Each thigh, we're going to divide that into 2 zones. Your upper arms are going to be 2 zones. That's 12 different sites. Week number 1, you're going to start with your right belly upper. Week number 2, left thigh outer. Track it, never hit the same zone within 4 weeks. And avoid broken or irritated skin. The medication won't absorb properly. Another common thing that's overlooked is the belly does tend to absorb fastest. Arm is moderate, and thigh can be slowest. Random switching means unpredictable hunger control. This last mistake seems minor, but fixing it can transform your whole experience. Cold Ozempic doesn't just hurt, it can actually reduce effectiveness. 30 minutes before your injection, set a timer. Room temperature medication will flow easier, absorb better, and drastically reduce those red welts that people complain about often. Those injection site reactions, usually not allergies, it's physics. Cold liquid hitting warm tissue creates irritation. Simple fix, but massive difference. Quick storage note, unopened pins, keep them refrigerated. Once opened, you have about 56 days at room temp or in the fridge. Mark your calendar because potency does drop after that. Now, after your injection, here's the safe way to dispose. Take the outer cap that you saved, place it on a flat surface, guide the needle in, then twist counterclockwise to remove. Never recap with your hands, that's how accidents can happen. Straight into the sharps container, never throw needles in regular trash. 3 more pro tips that we teach our patients. Number 1, wash your hands first, basic, but very critical for preventing infection. Number 2, see a bubble underneath your skin after the injection, you went too shallow. Be sure to pinch more skin next time. And number 3, this is not insulin. Weekly injections mean different rules. Stop applying your daily injection habits to your GLP-1s. If these insider tips are saving you money and improving your results, hit that subscribe button because we're dropping clinical secrets twice a week that your doctor doesn't have time to explain. Look, proper technique can save you thousands and transform your results. Which mistake were you making? Drop it in the comments below. I read every single one. Remember, always work with your healthcare provider about your specific situation. This is education and not personal medical advice. And if you guys have questions about the bigger picture, not just how to inject Ozempic, but more importantly, you're looking for guided and tailored advice, more of an approach that implements our strategies, using the lowest dose possible of your GLP-1 medications and achieving long-term lasting weight loss, I'll be sure to include a link in the description where you can book a free discovery call with one of our experts. This is your chance to learn about what the whole big picture looks like and what kind of options you have in front of you for achieving long-term lasting weight loss. We'll see you guys later.